Welcome to the Synapse Podcast. I'm Lauren Prager, Synapse CEO, and I'm coming to you live from Meta Center Global Week here in downtown Orlando, where Synapse has been a part of hosting this inaugural event for the last few days. And I'm really excited to be here with the innovation team with Orlando Health. They've been a part of Synapse Orlando and really part of the greater Orlando community for a very long time and part of Synapse Orlando since our very first gathering back in 2019. And they've created a structure for really generating an innovative community within the entire hospital system. And I wanted to introduce you to some of the folks who have been creating those opportunities and share with you their story, because I think there are a lot of lessons learned when something as complicated as a hospital system is actually able to support innovation and iteration and bring that into patient care. So I'm going to turn the mic over to our team and give them a chance to introduce themselves and share their story. So welcome, you guys.
Thank you.
Yeah. So why don't you take a moment, introduce yourselves, and we can kind of talk about what you do and how you've done it, and we'll kind of go from there.
Sure. Hi, I'm Jen Foley, Manager of Brand Management and Governance at Orlando Health and the innovator of the ArthurApp.
Hi, I'm Mike Schmidt, Vice President of Strategic Innovations for Orlando Health.
And I'm Patrick Roza. I'm the CEO of ArthurApp.
So, Mike, I want to start with you because you've been part of the Orlando Health team for a long time. You did not start in venture, as you were telling me. So share a little bit about the journey and how Orlando Health Ventures has evolved and set the stage for where we've come from to get here.
Yeah. So, Orlando Health is now a 105-year-old healthcare system based here in Orlando, Florida, just down the street from where we're recording. But having a formal innovation program and strategy is a very new thing. We just reached our 6th birthday.
Oh, congratulations.
So it's a very new thing. Our senior leadership team several years ago refreshed kind of what Orlando Health was going to grow into and develop into, and, a very ambitious and thoughtful plan for how we grow as a healthcare system. A critical piece of that is how we engage our team members, specifically clinical team members and physicians, to uncover ideas for innovation. What a lot of health systems that have started programs like this have found is there's a huge disconnect between healthcare startups, new technology in the market, and the people actually providing the healthcare.
Yeah.
And that disconnect means it takes longer for the innovative things to get into use, to get proven out, all the things that need to happen quickly to gain adoption. So our program really was designed to help bridge that gap, to make sure we were getting some of the best things outside of the healthcare system into Orlando Health. But more importantly, the people who know what needs to be innovated, what needs to change, are the people providing the care.
Yeah. Oftentimes we find that a company will have an innovation team or a chief innovation officer, and it almost kind of insinuates that everybody else is not really innovative. And, we've got this on lock in this particular corner of the building. So how did you create a culture of innovation that really got to people who are both on the clinical side as well as, in Jen's case, even the brand management or engagement side?
Yeah. So, the first year was really trying to figure out what we wanted to do. And I spent a lot of time talking to leaders, physicians, team members to really get a sense of where are people already doing stuff that's interesting? Where are they innovating? And from their perspective, what should we be, helping advance? What was readily apparent was there was a, significant number of people ready to jump in and start doing something. They had been waiting for a resource. Their leaders might say that's a great idea, but I don't know what to do with you, what to do with it.
Right.
So there needs to be a what next, and then who helps you. So we set out, initially as a team of one, and we've continued to grow to build a team that can meet with team members, review those ideas, pick the ones that strategically are significant to Orlando Health and will create an impact within the system somewhere. We can't take on every idea. We consistently get 60 to 70 product ideas a year.
And this is just from your internal
just from Orlando
team.
Health team members.
That's phenomenal.
Each one of those could turn into a product. So, many of them could turn into a spin out business. And so we have to be thoughtful about which ones we take on. And so we look for the ones that will generate the biggest impact within Orlando Health.
Yeah.
And then also, assume if it's working for us and Orlando Health really likes it and there's benefit, other healthcare systems are going to want this too. And so the goal is that nothing stays just within the confines of Orlando Health. It needs to grow outside of us. And so Arthur is our first true spin out, the product that has kind of continued to gain adoption. The clinical team members love it. And we've gotten to the point where we've brought in Patrick now to help lead this effort and kind of pass the baton off
Beautiful.
and let his team kind of take it from there.
So Jen, would you introduce yourself, share with us a little bit about your background, your experiences, and how
Sure.
you came to be a part of this project and be able to share your idea that's now become ArthurApp?
I'd be happy to. Thank you so much. So Jen Foley, Manager of Brand Management and Governance at Orlando Health. And I've been with Orlando Health over 26 years now. Started as a graphic artist in the creative area, worked my way into leadership positions, and now in the brand, like I said, management and governance area with the larger strategic communications division. And Mike and I have worked together since he's been with Orlando Health almost 15 years now. So we go way back. But you said it really well. You know, Orlando Health wanted to create a culture that would be very open for team members to submit ideas and feel not only good about it, but safe about it too, because you're letting go of an idea in a corporate world. So that was a hesitation for me at first. But when I went to the first workshop, and they did a great job of introducing the whole strategic innovations division and foundry, I just decided to let my idea out. And from there, it's been really organic process, and it's grown beyond where I could almost even imagine, like being here today in this podcast with you. It was awesome. So it started with when they put the program out, I thought of an experience we had with my dad going back about 12 years ago now, 13, where after surgery, he was intubated and he couldn't communicate. He kept trying to tell us what he needed. We kept guessing. He shook his head no, and he just stopped trying.
Oh gosh, that's heartbreaking.
It was very hard, very frustrating. I even asked the floor at that time if they had some type of chart he could use, but they didn't. So I made him a simple ABC chart, and he pointed to the letters glasses.
Oh, wow.
So the next morning we got that far, and then he was able to use the chart to communicate with us more. So fast forward, you know, all those years to when the foundry started, and they were looking for ideas to improve patient care. That experience is what prompted me to submit the idea, and it was accepted. And now we have the app that will speak out loud for patients who have an inability to speak. We have a curated set of words and phrases. It also has a whiteboard and a keyboard. And what we've discovered is that the patient-initiated communication is so important to how the patient views their overall care, even. So rather than just answering a set of yes/no questions, they can now verbalize what is going on with them. And we've got some great stories. I can share one with you that's very impactful. A gentleman had sepsis, and he had amputation on his legs. He kept pushing off his covers, and the nursing team thought he was just hot. And then 6 hours later, he was introduced to the ArthurApp. He was able to point to the part of the body where he had his pain, point to the pain level, and the nurse now knew he was in severe pain.
Oh, wow.
They got him pain medicine, and he started crying.
Oh, he was so relieved.
He was so relieved.
I haven't even heard that story yet.
That
That's
information was like trapped in him. You
Wow.
can't get there, you know,
Yeah.
with a lot of yes/no questions.
Yeah, just such an important thing that we forget sometimes is, you know, taking care of the physical needs, is the mental and emotional needs
That
of your patients and their families and loved ones who are there trying to help be their advocates. So
That's a great
really
point.
to create that smoother pathway
Mhm.
is really transformative in the way that we think about patient care. And especially interesting that you do not have a clinical background,
Right.
but your ability to translate that clinical experience
Yep.
to something that's going to really
Yep.
help
Resonate.
help the clinical care team and help the patient team is remarkable.
Yeah, and you brought up a good point, helping the clinical care team.
Right.
Because many times they'll have to bring in someone else to try to figure out what the patient needs. But now they understand what the patient's feeling, the question they may have, what they're experiencing, and they can react to it.
So when you first went down the path to explore this app, were there reservations or challenges that you found in introducing a tool like this? And how did you
Challenges, for
navigate
sure.
that, right?
Yeah.
Because especially when we talk about healthcare,
Yeah.
there are, understandably and necessarily so many regulations to help
Yep.
keep patient privacy safe and
Yep.
make sure. So how do you navigate experimenting with a new technology and still, being willing to try something new on the floor, especially when your care delivery advocates are so overwhelmed just with the basics, and now they're trying to navigate this new app, which is very easy to use in this iteration that I just saw. So what are some of the experiences, maybe best practices, or even failures that maybe you'd be willing to share so we can learn from them?
So I want both of us to answer because he has a very similar experience with his previous company.
Okay, great.
Which I'll let him kind of explain, but challenges galore. This entire process is disruptive. We work to try and minimize that, but it is disruptive innovation. You're either inserting something brand new into a workflow that's generally pretty established, or we're taking something away and replacing it. And oftentimes it's an unpolished prototype where we're trying to get that evaluation and feedback as quickly as we can. The secret sauce to us is the way we build teams. So Jen had a team of nurses, respiratory therapists, speech therapists, kind of working with her and with us initially. The two of us cannot figure out what we need to build from the outset. So we really have to get the right group of kind of diverse clinicians and other team members around the table and working together to help figure out, okay, what are we missing? What else do we need to factor in? How does this need to be developed? And then it's really taking those things through a process of putting them in the hands of the patients and with other team members. And, we have a saying that feedback is a gift.
Yes.
We're either going to succeed or we're learning something. And so all of the features that are in there today have come from patients saying, I wasn't able to do this with what you showed me, and here's what I was trying to communicate.
Got it.
Or, the whiteboard feature came
whiteboard,
from patients saying, some of these things, it's going to be quicker for me to draw than tap 4 buttons.
Yeah.
And then just how the nurses have rallied around it and have said, okay, we've done this. Let's add a help button feature so they can live chat with us from the room to the nurse's station.
Right.
Oh, yeah.
Just to shortcut some of those trips to the room for simple things.
Yeah, sure.
So all those features, they come from our process and letting patients and team members alike get their hands on it, use it, and help us understand how it needs to grow. So it's a process of strategically being vulnerable and inclusive with helping everybody that, we've shown it to and had, participated in the early studies say, you guys are helping us form this thing.
Yeah.
You help decide what it grows up into.
But you also truly listened, which I think was
Try to.
evident in the product.
Yeah.
Patrick, why don't you introduce yourself, your background, and how you've kind of joined into the group as well?
So my background is I had a software company that actually started out of Orlando Health. It was an idea by 2 physicians. And that idea started before this department existed. So we didn't have the incredible resources that are here now. What was great is Orlando Health was always supportive. And I think that's the difference between the DNA of some healthcare facilities and others. Even though they didn't have the infrastructure, they were always very supportive of us, which we're grateful for. But anyway, the software allowed patients to communicate, doctors and nurses to communicate to families when you're in surgery. So rather than sitting in a waiting room not knowing what's going on, the nurse in the OR could send you a play-by-play of what was happening. And for us, our biggest challenge was, how do you fit this into a workflow that is already set in stone?
And very controlled.
Yes.
Very controlled environment. There's a cadence to everything. There's sterility issues. And for us, where we were fortunate is 3 of my partners were physicians, so they knew the workflow. Okay. So they could tell me as a business person, as a tech person, the functionality needs to be this. Our nurses are going to hate this. I mean, I remember countless discussions where I would come up with an idea that I thought was great, and they would say, the nurses are going to hate that.
Yeah.
And so always looking through that lens of how does this affect our nurses was also key to making sure that we made a product that was successful.
Such easy and basic fundamentals, but so often, and throughout these few days as we've been talking with technologists and innovators, we try to remember to ask them, are you actually involving your target audience, your user? And so often they forget, to really engage the user. So good for you for being, again, vulnerable, willing to take that feedback and iterate on that. So now you got involved from that company and stayed involved with Orlando Health and helped with the evolution of ArthurApp. So how has that progressed? Now this has become, an even more impactful tool?
Sure. Yeah, to me, it was very exciting. I actually, to be honest, I was very nervous at first because I was very scared of hospital bureaucracy, and I did not know how it would be. And I had a very candid conversation with Mike.
Yep.
And within 10 minutes, I was like, okay, this has legs.
Mm-hmm.
And it wasn't that the idea didn't, because I've always thought ArthurApp was a great idea. But I mean, our software was in 170 hospitals, and all of them were just red tape and more red tape and 700 meetings to get any decisions done. And what I loved is I said to Mike, I was like, well, who makes the call? What are the boundaries here? And once we had that kind of conversation, I was like, okay, I can actually treat this like a startup and make decisions fast and be nimble.
So Mike, how is Orlando Health able to create such a streamlined process? Because again, with something as highly regulated as healthcare, that has so many understandable and necessary layers, but innovation does matter. And, ideas are valued. Execution is worshipped, as our friend Jeff Hoffman likes to say.
I like that.
And I go back to that a lot. So, yes, a lot of times good ideas go to committee to die. So how did you make sure to create a pathway?
First and foremost, support from our senior leadership team, especially our CEO, who loves this work. He loves this sort of stuff. So we have a lot of latitude to pursue and kind of structure things the way we need to. So strategic innovations is our umbrella. We have several components within that. So that's a department within Orlando Health. The Foundry program is what developed the ArthurApp. That's our new product development.
So
incubator.
Engineers who work for Orlando Health and are here to help make sure that these ideas have the technical support to be able to be built in-house.
And then contractors, right?
And a network of, our first developers, a Orlando-based startup company called Slidewave. They helped us kind of build and test the first version. So we have a network of development partners to help. We try to minimize the requirements on team members within the system. They need to care for patients.
Sure.
So I can't steal somebody for 6 months to help develop something. So we get guidance and kind of set the boundaries and milestones with internal folks, and then create the right kind of external team to help us move fast and kind of continue to grow each thing. The other side of strategic innovations is our venture funds. So we have Orlando Health dollars set aside to invest in healthcare startups whose products and services we like. And the kind of second chapter of that last year was we set aside some money for a seed fund to help invest in the companies that graduate out of our Foundry program, and ArthurApp's the first one.
All right.
We've got a couple others behind that. And so the goal always has been to get this as the universal communication tool across Orlando Health, and then bring in the right team to help commercialize this and kind of take it from there. So this year has been a process of me and my team handing everything off and getting the seed funding in place so that Patrick can build the team and grow from there. And I could not be happier. I feel like we won the lottery with the team that he's been able to bring in.
We're gleaning from their experience.
Their past experience.
Sure.
Yeah.
That's great. So you brought in a seasoned founder who's very familiar with healthcare and understands the dynamics of working with clinicians, with somebody who has a real passion for this personal experience and a willingness to be agile and truly invest from a fundamental corporate side in creating something. I mean, it seems like a very simple recipe. I'm sure it's not, but when you kind of distill it down, looking at the three of you still smiling after this whole process, and now, so is Orlando Health Ventures now has an equity stake in the growth of this? Great. And for those who don't know, share a little bit about the size of the Orlando Health community, because even though it's called Orlando Health, you're not only in Orlando, Florida.
Yeah, it used to be easy because we were just in Central Florida, but we have a significant presence across all of Central Florida now. A very rapidly growing presence in the St. Petersburg market, growing into Tampa. So really, it's all of Central Florida. And then as of late last year, we have a presence in Puerto Rico now, which is really cool.
Awesome.
And hopefully we get to go launch Arthur down there at some point.
Yeah.
But yeah, Orlando Health is very much focused on the state of Florida and beyond, where we can grow our services. We have some things like our Cancer Institute and our new Jewett Orthopedic Institute, which really draw from across the Southeast.
Wonderful.
And so we're trying to make sure that our services are available as far as we can make them available.
That's wonderful.
Yeah.
Thank you all for coming to Synapse Orlando and MediCenter Global Week, for sharing your story, being a part of our exhibit. We have a really dynamic community of local companies, global brands that are here. So we're really proud that there's space for ArthurApp and Orlando Health to showcase amongst some of these tech giants and really be seen as the innovators that you are and sharing your story. And, hopefully none of us ever need to be in that situation where we need your app, but it really gives a lot of comfort to know that if us or our loved ones are in that situation, now they can communicate what they need in a really special and beautiful way. And this is great lessons learned for all of us. So thank you for sharing your
our
story.
pleasure.
We're really proud to
Yeah.
showcase what you've created. And you are definitely part of the reason that, as we like to say at Synapse, innovation lives here.
Yep.
Love
Love it.
Thank you
Thank you.
guys.
Thank
Yeah.
you.